did, and the vaccine wasn't responsible. So it's very difficult when two things happen at the same time to be able to make an exact reason as to if that's what happened to cause it. So what we do is we admit that there's safety issues with vaccines.
Right.
They're not 100% safe. Nothing in life is 100% safe. Driving or walking here today is not 100% safe. I could have a heart attack right now. Cannot predict it. But what we can do is try to do the best that we can with the information that we have.
You've been voted out by the majority. Please return to your seat.
Thank you.
Okay, thank you.
Hi, Dr. Mike.
That was smooth. Hello.
He's got that wrist flowing. I'm actually a fan of your channel. I've been watching for a while.
Thank you.
I am a pediatric hematology oncology nurse.
Wow, okay.
I think a lot of mistrust in my eyes were opened during the whole COVID pandemic.
Why?
Institutions that were there, I used to be in the military, so when I was in the military, I signed my bodily autonomy away. If they told me to do something, I did it.
And thank you for that.
Yeah, thanks.
No, I say that in all seriousness because I think a lot of times that kind of becomes habit just to say thank you, but I really do mean that thank you.
I appreciate that. So seeing, how Dr. Fauci, who was just pardoned, and that's a whole other discussion, seeing how we were sold a bill of goods that we, the American tax dollars, paid for while these pharmaceutical companies reaped millions and millions of profits on. And I think that caused the goalpost, the vaccine, this mRNA vaccine, it's going to prevent the transmission of COVID, it's going to prevent you from getting it, and others, if you don't get this vaccine, you hate your grandmother, you're going to kill all these people, and you got to do your duty and get it. Well, you know what? My grandmother got it, and she died. I saw her take her last breath.
I'm sorry.
And it's a very profound thing to see someone that you love take their last breath and go on to whatever happens after.
Of course.
So when those seats, and it turns out the 6 feet of social distancing was not based on anything, how can you not expect people to question these higher institutions that are deemed to look out for the well-being of people and they don't?
It's a great question.
So just like with Black people who don't trust the government because based on the Tuskegee experiment in 1932, actually 40 years after that, the New York Times, they actually infected them with syphilis and they let them infect their families, their friends. It ran rampant. So how do you expect certain people when they've been burned by the government to all of a sudden, all right, well, I'll trust you now? Ultimately, it's people's choice. Just like if someone wants to refuse a treatment, we give them an AMA form against medical advice. I think it's all up to people's choice and their autonomy.
There was a few topics that you touched that I think are really worth discussing. First, bodily autonomy. I believe that, and that is the sole principle by which we practice medicine. Vaccines fall in a unique category because your decision on vaccinating your child and then sending them to school can impact other children in that school. So much like drinking and driving as an example, your choice to do that puts your life at risk, but it also puts others at risk. So we deem that as dangerous for the general public. This is why vaccines, it becomes a little more complicated when we talk about bodily autonomy. When it comes to our government, our mandates, pharmaceutical companies, there's absolutely reasons for distrust. I love that everyone in this room is a skeptic, and I encourage skepticism. I don't think anyone should just go into a doctor's office and say yes, 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 yes. In fact, I love when my patients question me. I empower them to ask questions. Doctors sometimes get this attitude where they're like, oh, you Googled before coming here? Google search doesn't replace my degree. No, that's not how we're supposed to be. What I get excited about is if you Googled and you have questions, now I know exactly the route I need to take to help you make a decision that's right for you and your family.
Okay, pause. You've been voted out by the majority. Please return to your seat.
Thank you so much. I appreciate it. Nice meeting you.
How you doing?
Pleasure to meet you.
Yes, Root Scott. Good to meet you as well.
Love the jacket.
Thank you so much. So I really want to talk to you about this claim based on all of the other things that are causing disease, the chronic conditions that are in this country, all of the metabolic issues, and this is stemming from colonization. putting smallpox blankets on indigenous cultures, sterilizing people in Puerto Rico, Honduras, all of these different things that have happened. And if you look at Africa, oh, by the way, Bill Gates did say something interesting. The next war will be fought with biological warfare. And I think that was raising eyebrows, especially when you look at the Kissinger report, right? For those of you who don't know about the Kissinger report, it's all about pretty much reducing the population of the planet. So I don't know how you can make this claim and really defend vaccines in the nature and the world that we're living in, where we are actually going away from nature. And the further we get away from nature, the more diseases we will see. So, you know, I'm very passionate about this, and I want to be able to have like a real discussion with you, because yes, you're a medical doctor, but this is also a system that J.D. Rockefeller started, getting rid of all types of indigenous practices, and this land is stolen land. So when we're not even honoring the source, when we're not honoring the land, the ancestors, ancestral intelligence, the real AI, when we're not even honoring these things and we're just supposed to trust science. No, I trust my scientists. I trust Dr. Sebi, I trust Dr. Aris Atham, I trust Dr. Yaqui. Because this system is not for us. It's not built for people like me. It's not built for any of us. Because even the opioid crisis, we saw a lot of Caucasians suffering from that. So how can you sit here and say that this vaccine is killing people when this system is currently killing people? When we even have to have an administration that comes in now and says, ooh, we got to start looking at all of these different toxins in the food, in the medicine, in the soil. I don't think it's fair for us to take this vaccine when we're already being forced to take polluted food.
When you say take this vaccine, which vaccine are you talking about?
Well, really all of them. It should be a choice, because even when I was younger, I didn't take as many vaccines as the children have to take now. These children are sicker, they're going through more metabolic issues, they're having mental health issues, and now I don't think it's just the vaccine. It's the system that's perpetuating this type of lifestyle. Yes, that child who was even in the hospital under those fluorescent lights, I'm not surprised that they had a seizure before, because this is an environment that is not conducive to life. This thing that I'm wearing on my chest is called an ankh. Y'all replace this. Y'all replaced our cultures. This life representing thing, you replace it with death culture. This is not a healthcare system. It's a sick care system. And honestly, I cannot sit here in good faith and not represent all of the people who have come before me.
Yeah, absolutely. I respect that. I came to the United States as an immigrant living on welfare. So I got put into this same system that you're describing. It's a shitty system. The world is changing in ways that make our lives more unhealthy. We're eating more processed food. We're exposed to more chemicals, usually as a result of products that we actually enjoy. So when I complimented you on that great jacket, when someone wears a specific pretty strap on their Apple Watch, there's chemicals in there. There's forever chemicals in there. So for every amazing thing that we have in society, there's been drawbacks. The good part about our society is that we're constantly monitoring those drawbacks and are trying to create solutions for our own problems. So when I think about our current healthcare system, where I think it needs to do better, is it needs to focus more on prevention rather than cures. Agree or disagree?
1,000%, yes, sir.
Do you know how we can do that?
Not through the vaccines, but one way we could do that is connecting more to nature. One way we could do that is making sure that we're not poisoning the food. One way we could do that is treating each other better with more respect and actually getting rid of these systems that are putting us against us, this divide and conquer, the media manipulation, and all of this fear tactics that was pushed during this vaccine COVID mumbo jumbo. Yeah. This was totally.
Do you think we should do all of it?
Okay, sorry, pause. You've been voted out by the majority. Please
Thank you.
return to your
Appreciate
seat.
that. Thank you.
Hi,
Hello.
Director.
Pleasure to meet you, sir.
How are you? Pleasure to meet you. So I'll let you know I'm Tom. I'm a police lieutenant from northern New Jersey.
Okay.
And what struck
Local.
me about your statement about body autonomy and children and the COVID vaccination. What would you say if I told you I had 3 daughters and my spouse and I had differing opinions on whether our children should be vaccinated with the COVID vaccine? And a judge orders that vaccine be injected into my daughters. I'll give you a little bit of data first.
Okay.
And this was part of my reasoning with the courts. Risk versus benefit, correct? From 2018 to 2023, if we trust the CDC, their numbers say the most deadly thing for our children, the #1 deadly thing, do you happen to know what it is?
Guns.
accidents. Not necessarily guns, but accidents.